Have you ever imagined waking up without knowing you slept? Your body walking through the house while your mind remains in a deep abyss of unconsciousness? Welcome to the world of sleepwalking, one of the most intriguing and terrifying mysteries of modern neuroscience. Every night, between 2 and 3% of adults worldwide face this extraordinary phenomenon, but most have no idea what actually occurs inside the brain during these terrifying episodes. Recent studies reveal that it is not simply a body on autopilot. In fact, something far more frightening is happening in the deep layers of your mind. Research from renowned neuroscience institutions has identified completely disconnected patterns of brain activity during these episodes. In this video, discover the hidden secrets of sleepwalking, from scientific causes to the real risks few people understand. Prepare yourself for a journey through the darkest manifestation of sleep, where the body acts independently while consciousness sleeps deeply. Sleepwalking, scientifically termed parasomnia, represents one of the most bizarre and fascinating states of the human body: partial arousal. Unlike what many believe, the sleepwalker is not simply sleeping deeply with eyes closed. Quite the opposite. Advanced neuroimaging studies show that the sleepwalker has a unique neurological condition where only specific parts of the brain awaken while others remain in deep sleep. It is as if two realities coexist simultaneously within the same mind. Sleepwalking occurs specifically during stage 3 and 4 of non-REM sleep, also known as slow-wave sleep or deep sleep. At this point in the sleep cycle, the body should be completely immobilized by the muscle atonia characteristic of deep sleep. However, in genetically predisposed people or under specific circumstances, a failure in this protective mechanism allows the body to move while consciousness remains buried in deep unconsciousness. Researchers from the Dutch Institute for Neuroscience conducted a revolutionary study and discovered something disturbing. In 56% of sleepwalking episodes, patients reported having vivid dreams while walking. Some described scenarios of imminent danger, such as ceilings collapsing, houses burning, or lost babies. Essentially, the mind was experiencing an imaginary world completely disconnected from reality, while the body acted independently. Episodes typically begin 1 to 2 hours after falling asleep, when the body reaches the first deep cycle of non-REM sleep. Episodes usually last 5 to 15 minutes, although extreme cases have recorded episodes lasting up to 1 full hour. During these periods, the sleepwalker exhibits paradoxical behaviors that confound observers. The eyes are completely open, but the gaze is vacant and directed upward at an abnormal angle. The person walks with purpose and determination, as if following an invisible mental map, navigating the environment like a perfect automaton. Speech can be coherent and well-structured, but completely disconnected from reality. When confronted during an episode, the sleepwalker responds slowly or remains unresponsive to external stimuli. Memory of the episode? Virtually non-existent upon waking, as if those actions never occurred. The prevalence of this condition is significantly higher in children, affecting up to 5% of them in the past 12 months. In adults, this number drops to approximately 1.5%, but remains surprisingly common for a potentially dangerous condition. Historically, incidence decreases drastically with age, because the natural amount of deep sleep decreases as we age. A child spends approximately 80% of sleep in non-REM state, while an adult spends only 75%. You possibly inherited sleepwalking from your ancestors. Documented research shows that approximately 60% of all sleepwalking cases present a significant genetic and hereditary component. If one of your parents suffered from sleepwalking, your chances of developing it increase dramatically, becoming 10 times more likely compared to the general population. If both parents suffered from it, the risk becomes even higher. Specific genes linked to sleep disorders have been identified by researchers as direct contributors to this hereditary predisposition. But genetics is not the only villain in this complex sleepwalking story. Psychological stress is a devastating and thoroughly documented trigger. Recent studies discovered that 59% of sleepwalkers reported specific triggers that increased both the frequency and severity of episodes. The main culprits? Stressful events, sleep deprivation, intense emotional reactions. Surprisingly,
positive emotions also increase incidence. Any factor that naturally increases the amount of deep sleep can provoke an episode in predisposed individuals. Sleep deprivation is particularly insidious and dangerous. When you do not sleep properly for several consecutive days, your body compensates by dramatically increasing the amount of deep sleep at the next opportunity. This deep sleep rebound creates neurologically perfect conditions for sleepwalking episodes. Professionals with irregular schedules, new parents, students during exam periods, and anyone under chronic stress are at elevated risk. Chronic anxiety fragments the natural sleep pattern, making sleepwalking episodes more likely during abrupt transitions to deep sleep. Patients with generalized anxiety disorder present 3 times higher incidence of sleepwalking compared to control population. Maintaining unstable sleep through nights fragmented by worries creates a biologically perfect scenario for parasomnias. Other significant contributing factors include psychotropic medications, especially tricyclic antidepressants and certain benzodiazepines, which paradoxically can trigger episodes by fundamentally altering sleep architecture. High fever, uncontrolled asthma, obstructive sleep apnea, previous head trauma, and even a full bladder before sleep have been documented in studies as potential triggers. Women of reproductive age present higher incidence, suggesting a hormonal component not yet completely understood by the scientific community. Here is the truly disturbing aspect that few fully understand. Studies using single-photon emission computed tomography, SPECT, and functional magnetic resonance imaging revealed completely disconnected and abnormal patterns of brain activity during sleepwalking episodes. The cerebellum and brainstem are fully active. These structures are responsible for coordinated movement and primitive automatic reflex responses. Simultaneously, cortical regions of the frontal brain that control rational decision-making, explicit memory, logical thinking, and self-consciousness remain deeply asleep. This explains why sleepwalkers can perform surprisingly complex tasks, walking without stumbling, opening doors with precision, even driving in extreme documented cases, while remaining completely unconscious and without later memory. The body follows automatic routines learned over years of practice, while the rational mind is completely offline and absent. It is a functional dissociation between automatic motor execution and genuine consciousness.
Brain regions controlling basic vision, motor movement, and primitive emotional response appear to be activated and functional, while areas responsible for explicit and conscious memory, formation of abstract concepts, and advanced logical thinking remain profoundly asleep. The neurological result? A person who can navigate the environment using procedural memory and instinct, respond to simple stimuli reflexively, but who is fundamentally incapable of perceiving real danger, completely incapable of making rational decisions based on contextual information, and totally disconnected from conscious reality. Researchers discovered through rigorous studies that physical sensation is virtually switched off during severe episodes. A sleepwalker would not feel acute pain if stepping on broken glass, would not hear verbal warnings directed at them, would not understand complex language or abstract reasoning. The body functions like a robot, guided by primitive ancestral instinct, while the conscious and rational pilot is completely absent. Most people, and even healthcare professionals, consider sleepwalking a harmless and trivial condition. This widely disseminated perception is lethally mistaken. A comprehensive clinical study of 100 adults clinically diagnosed with sleepwalking revealed truly terrifying statistics. 58% of patients reported positive history of aggressive sleep behaviors. Even more shocking, 17% experienced at least one episode involving serious injuries requiring emergency medical care and hospitalization. Documented injuries include significant bruising, profuse nosebleeds, multiple bone fractures, and in one notable case, severe head trauma after a 27-year-old sleepwalker jumped from a third-floor window of a hotel in Rio de Janeiro.
Adult women present more than double the probability of dangerous behaviors compared to men, including handling sharp objects and knives, turning on stoves and burners, leaving the house alone in the middle of the night, or even driving cars at normal speed. Studies in American emergency rooms analyzed all admissions associated with trauma potentially related to sleepwalking. Of 620,000 emergency admissions, 11 were confirmed as related to sleepwalking-related accidents. Although appearing numerically insignificant, it represents potentially fatal injuries that were probably underestimated by researchers. Injured sleepwalkers frequently have absolutely no memory of how they were injured or what caused the injury, making epidemiological connection difficult to establish definitively. The consequences extend far beyond visible physical injuries. Patients diagnosed with chronic sleepwalking present significantly greater daytime sleepiness during the day, persistent chronic fatigue, paradoxical insomnia at night, elevated and clinically diagnosable symptoms of depression and anxiety. Overall quality of life is demonstrably impaired and reduced. Bed partners also face direct risk of injury during potentially aggressive episodes, creating stressed family dynamics. Unlike many debilitating medical conditions, sleepwalking does not have a definitive cure based on evidence. However, it is manageable and controllable through multiple interventions. Treatment begins fundamentally with environmental and behavioral modifications in the home. Sleep experts recommend installing sturdy bars and screens on all floor windows, locking all doors and dangerous areas of the house, removing sharp objects and knives near the bed, using significantly low beds, and in severe cases, consider placing mattresses directly on the floor. Electronic alarms that gently awaken the person when detecting bed departure have proven effective in reducing episode frequency. Some specialized sleep centers will recommend constant partner vigilance during initial nights, although waking a sleepwalker should be done gradually and with extreme caution. Abruptly awakening someone during a sleepwalking episode can result in extreme disorientation for several minutes, defensive aggression, or inadvertent self-injury. Pharmacologically, benzodiazepines, especially oral clonazepam before sleep, have proven clinically effective in reducing frequency when behavioral measures fail. Melatonin at elevated doses, 3 to 18 milligrams, offers an alternative with fewer associated side effects. Certain antidepressants like imipramine can be prescribed, although paradoxically, some psychotropic medications increase episode incidence. Sleep hygiene is fundamental and non-negotiable. Maintain an environment cool between 16 and 18 degrees Celsius, completely dark without light sources, absolutely quiet. Avoid alcohol consumption in hours before sleep and all stimulating substances like caffeine. Maintain regular and consistent sleep schedule. Practice daily relaxation techniques and meditation. Consider intensive cognitive behavioral therapy addressing underlying anxiety and psychological trauma. When sleepwalking is secondary to other medical conditions, untreated sleep apnea, persistent fever, respiratory disorders such as asthma, aggressively treating the underlying condition often completely resolves sleepwalking episodes within weeks. Sleepwalking remains one of the great unsolved neurological mysteries, a state where consciousness and movement disconnect in a profound and profoundly disturbing way. It is not simply a folkloric curiosity of sleep. It is a real condition affecting millions globally that carries genuinely serious risks and deserves serious medical recognition from healthcare professionals. If you or someone close to you experiences frequent sleepwalking episodes, seek comprehensive professional evaluation. Do not dismiss this as trivial. Most cases are successfully manageable, especially when diagnosed early. Your safe sleep deserves genuine medical attention. The next time someone casually comments that sleepwalking is completely harmless, you will know the dark scientific truth behind the widespread illusion of safety.